Today I'm going to be talking about why is the diagnosis of fibromyalgia and related conditions delayed. One of the reasons why it's delayed is due to a lack of training or specialization to manage people who have fibromyalgia and related conditions. This is because many people who may make the diagnosis, like rheumatologists, aren't really trained in the biopsychosocial model. They're much more likely to be trained in managing inflammatory conditions. And most primary care doctors have so much else they have to take care of and manage that they don't typically have the training and experience and effort. And it's really hard, and it takes a lot of extra training beyond what they got in medical residency. And that's kind of how I learned about this, is through ongoing interest in education. Another reason why the diagnosis of fibromyalgia is delayed: it is acceptable not to make the diagnosis. A medical director is not going to call you into the office because you did not make the diagnosis of fibromyalgia. If you keep on missing the diagnosis of diverticulitis, or miss the diagnosis of somebody having a heart attack or a blood clot or obvious cancer, then you're going to get in trouble. You might even get sued. So the default by many physicians or doctors is to not make the diagnosis, to say all your labs are normal and you're fine, just relax, it's a lot of stress, anxiety, or defer to another doctor to hopefully manage that. Reason number 3 for failure to make the diagnosis of fibromyalgia: it's the fear of making the diagnosis. You have heard of FOMO. It's a fear of missing out. In fibromyalgia, there is an apprehension about making the diagnosis. And why would that be? Well, another crucial factor contributing to delayed diagnosis is the fear among healthcare professionals in making the fibromyalgia diagnosis. This fear stems from the lack of experience managing the condition and the uncertainty surrounding the appropriate course of action. Unlike some other medical conditions where immediate action can be taken upon the diagnosis, fibromyalgia requires a personal biopsychosocial medical model to help you get better. This makes it more challenging to determine the right approach for each individual. When somebody's having a heart attack, there is a protocol that you go through. There's a specific algorithm. It's not so clear-cut when you're looking at managing fibromyalgia. Also, when receiving any diagnosis, a patient's logical question is, what is it? How do I treat it? And what is the prognosis? These questions often are not confidently understood by the physician. It's hard to say, I don't know. I'm sorry, I don't know what to do. Another reason that the diagnosis of fibromyalgia is delayed is due to the complex nature of fibromyalgia. Fibromyalgia is considered a nociplastic condition. That's spelled Nociplastic, nociplastic. It's a new term that many of you probably are not familiar with. Nociplastic is the semantic term suggested by the international community of pain researchers to describe a third category of pain that is mechanistically different from nociceptive pain, which is caused by ongoing inflammation and damage of tissues, and neuropathic pain, which is caused by nerve damage. The mechanisms that underlie this type of pain are not entirely understood, but it is thought that augmented central nervous system pain and sensory processing and altered pain modulation play prominent roles. The symptoms observed in nociplastic pain include multifocal pain that is more widespread or intense, or both, than would be expected given the amount of identifiable tissue or nerve damage, as well as other central nervous system derived symptoms such as fatigue, sleep, memory, mood problems, and brain fog. The overlapping pain syndromes and the cognitive struggles add to the complexity of making a definitive diagnosis. Furthermore, managing fibromyalgia extends beyond relying solely on medications. It requires a comprehensive approach that includes lifestyle modifications and self-management techniques, which many healthcare professionals are not adequately trained in. Another reason for delayed diagnosis of fibromyalgia and related problems is due to co-occurring conditions. Fibromyalgia often co-occurs with other medical conditions, further complicating the diagnostic process. These conditions may be outside the comfort zone of many physicians, making it harder to recognize the full spectrum of symptoms and provide appropriate management. Addressing these conditions and their overlapping symptoms becomes crucial for effectively diagnosing and managing fibromyalgia. Many will be more apt to diagnose some with depression or generalized anxiety disorder rather than make the diagnosis of a nociplastic illness like fibromyalgia, despite having failed trials of multiple SSRIs, and don't feel depressed, but more being fatigued and frustrated, living in pain. When patients share that they don't feel that it is a correct assessment, the physician is in a bind as what to do next.